everyone and welcome to my channel. For those who do not know me yet, I'm Annamaria, the pharmacist with the suitcase, your best travel and health expert, as so far I've been to more than 40 countries, the majority of them on solo trips, and I took a degree in pharmacy and a master degree in gem therapy. Through the contents that I share you, I want to let you discover how beautiful our planet is, and I want to help you organize your next holidays going seeing with your own eyes all the beauties. I'm also here to help you learning how to take good care of yourself while you are far away from home. As I'm a pharmacist today, I want to introduce to you a special topic. I'm not going to bring you on a tropical island or on an archaeological site or in a cultural town, as you might be used since almost all my videos so far have been shot in such gorgeous places. No, today I welcome you into my chemist shop because I want to talk about a very important subject and I desire to inform you about a major fact. Culture and knowledge are extremely important and to widen our horizons, build our personality, make us become a cultured person capable of living respectfully in the world. But there's also another very important thing for our personal growth. And you know what is it? The capacity of taking care of us. Once we take care of our body, also our soul and brain can peacefully live. Maintaining ourselves in good health is of primary importance, but how to do it? Prevention is the key. Did you know that from the 24th February to the 2nd March is the International Herpes Zoster Awareness Week? This is an opportunity to shine the spotlight on an often underestimated pathology, shingles. Although many are unaware of the risks associated with herpes zoster, the disease can have serious consequences, especially for some categories of people. What is herpes zoster? Herpes zoster is a viral disease caused by the reactivation of the chickenpox virus, which remains latent in the human body after a primary infection. This virus, known as varicella zoster, can reawaken in adulthood, even decades later, especially when the immune system is weakened by stress, illness, or drugs. When the virus reactivates, it causes a painful rash, usually appearing as red blisters on just one part of the body, followed by intense burning and pain. Although the virus can affect anyone who has had chickenpox, some groups are more vulnerable. Why is it dangerous? One of the most serious aspects of herpes zoster is its ability to cause long-term complications, such as postherpetic neuralgia, which manifests itself with persistent chronic pain, even after the skin lesions have healed. This pain can last months, or in severe cases, years. Additionally, herpes zoster can affect delicate areas of the body, such as the face and the eyes, leading to permanent vision damage. It is essential that the disease is treated promptly to reduce the risk of these complications. Who is at risk? Although herpes zoster can affect anyone, there are some categories of people who are at great risk. In particular, the elderly, people over 50 years old. As age advances, the immune system tends to weaken, making it easier for the virus to reactivate. Immunocompromised people, those suffering from chronic diseases, such as, for example, diabetes, chronic obstructive pulmonary disease, or cardiovascular diseases, or those undergoing immunosuppressive treatments, such as chemotherapy or biological drugs. These are particularly vulnerable. Cancer patients as well. Patients undergoing treatment for cancer, whether chemotherapy or radiotherapy, are among the most at risk, as the therapies aim to weaken the immune system to fight tumor cells, also making them exposed to viral infections such as herpes zoster. Those who have had chickenpox. The chickenpox virus remains latent in the body even after recovery and can reawaken at any time, especially if the immune system is compromised. The importance of vaccination. Prevention is the best tool to fight herpes zoster. Vaccination is the most effective method to reduce the risk of developing the disease and its complications. In Italy, vaccinations against herpes zoster is recommended and free for people over 65 and for people who belong to risk categories, such as cancer patients and immunocompromised ones. Unfortunately, many people are not aware of the possibility of getting vaccinated against herpes zoster or do not consider this opportunity a priority. The International Herpes Zoster Awareness Week initiated aims to fill this information gap, raising awareness among the population about the risk of shingles and the importance of preventive vaccination. How to recognize it? Recognizing the symptoms of herpes zoster at an early stage is essential for initiating antiviral treatment, which can reduce the duration and intensity of symptoms and prevent complications such as postherpetic neuralgia. The main symptoms include tingling, itching or burning in a specific area of the body, often one of the first signs, appearance of red blisters and develop in a delimited area, intense and persistent pain in the affected area, general malaise and mild fever. If you notice these symptoms, it is crucial to see a doctor as soon as possible to start treatment. Early diagnosis is crucial to prevent the virus from causing permanent damage. Did you know about these things? Have you already had chickenpox? I would be extremely happy if you could write me in the comments if thanks to this video you learned something and if you would like me to speak about some specific topics linked to health. If you know someone who had chickenpox or that is a patient at risk, please do send them the link of this video because it is of great importance to spread awareness. Let's take good care of us all together. If you don't want to miss the next videos, don't forget to subscribe to the channel and hit the bell icon, because doing like this, you will receive notifications every time a new episode will be uploaded. See you in the next vlog, around the world or here in the chemist shop. Ciao!